So you're gonna click on Loc, then you can hold Shift and click down here on Coronal PD Uni and hold Control now and click on the Axial PD bilateral. Perfect. You can bring those over and accept.
Alright, so we x-rayed the eye, everything is good.
Yeah.
Perfect.
Perfect. Let's get it going. Scan. And scan. Yeah, there you go. Alright, so the money slices in each of these will basically be like the head and neck of the femur. Okay, so that's what we'll be looking for. I'm gonna mark this up for the next person. Okay, let's go into the calibration scan. We're gonna look for the hips here.
These are gonna be all the way down at the bottom.
Yeah, so there we go. That's the money slice we're looking for. Go back one. Or that'll do. Yeah, but this is the one we're gonna plan off of. So I want you to drop your slices right there in between. That's where we'll receive signal. They cover above the iliac crest and below the Y and the lesser trochanter. This looks good. Let's save and scan. Yeah, I like that. Okay, go on to the next one. Axial T1 bilateral. Alright, let's move that out of the way there. And then let's window this so it's a little brighter, just a little bit. Perfect. And then let's unclick and take all. Love it. We're gonna look for that slice yet again. There you go. And we're gonna see if we can find it down here as well. Oh, we don't have it. That's okay. We're gonna get a new axle anyways. So basically, I just want you to. Oh, perfect. We have the head of heads at least. So go down one. Yeah. We're gonna have to go back. Okay. So I want you to just drop it right in the middle. The torso. Perfect. Now up here, I want you to angle with the femoral heads or the spine, whatever you prefer. Okay. Now, over here we're good. Now we're gonna work on coverage. So I want you to scroll up and down and check the iliac crest. We wanna be 1 to 2 slices above that. Okay, so right there. So let's go back 2 slices. That's where it's the highest. We can cut like 2. Perfect.
And down here we want the trochanters.
Yeah, so yeah, exactly. We want below the trochanters or the Y. So you can see the Y right there. So that looks pretty good. So no, we were good where we were because it's always going to be a little lower on males. So I'm sorry, let's go back up. I'm going to look for the lesser trochanter, which will be right there. It would be right there. So anyways, I'll show you once we come across it again. This looks good. So this is way too long. Let's optimize our TR. We're T1, so that means our TR has to stick between 350 and 750. So that means we can't increase it to 2 times 24, maybe 4 times 12. We can increase that. When we increase or decrease that, it only affects this top number. So let's increase it so we get to the lowest 12. Perfect. TR is optimized now. 4 times 12 is 48. Now let's open that up. We're gonna drop the next to 1 and the phase to 160. This will degrade the image quality significantly, but now it's a reasonable time. Let's do 1. Perfect. Save. And let's go into the Coronal T1. Now we're gonna find those money slices again. So it's going to be the very top slice. There you go. Okay, that's the best we have. A little bit of the head there and a little bit right there. Okay, so now we could drop our box right in between like the superior aspect of the femoral heads. Perfect. And if you want to rotate it a little bit so it goes more with the heads of the femur and the spine. So a little bit to the right. Perfect. Okay. So it looks like we could decrease our FOV because we have a lot of excess out here. So let's decrease it by 1. There you go. It's better. So down here we want to angle with the femoral heads. We don't really have those, so we're going to wait a couple seconds until we get part of our axial. There we go. So let's bring that one up, see if we have the femoral heads. Just window it down and to the right. There you go. Okay, let's scroll and see if we can find the femoral heads. Perfect. There you go. So we're going to use this. I just want you to make sure one of the lines like touches the top of both heads, basically. That's kind of the goal. Yeah, perfect. Okay. Now, finally, we're going to do coverage. We can do that from the sagittal plane because we can see everything superior to inferior. I want you to cut all the way to the anterior aspect of the pubic symphysis. So maybe one more. Oh, actually, let's add that one back. Yeah. Perfect. Okay. And then posteriorly, we only want the sacrum and coccyx. So let's add. Yeah, there you go. Happy with that. Okay. So 6 times 5 is 30. We only need 27. Why don't we increase it to get 3 times 9? We're still within T1 range, 350 to 750. So this looks good. 2 minutes and 30 seconds is solid. Save that and go into the sagittal unilateral. Now we're gonna bring up our money slice here, and down here we're gonna bring up the money slice, but from series 3, these new images that are currently scanning.
Is that one down? It's not done yet, is it? Yeah, it is.
No,
It's
we
still
have
at 50.
2 seconds. There you go. Alright, bring it up.
So I'm doing axial.
Yeah. Perfect. You don't have to window it. Oh no, never mind, that's perfect. So let's scroll down. We want to find the head and neck. Perfect. Head, neck, and this is the greater trochanter.
Alright.
Alright, so now what I want you to do is I want you to drop your box basically right where the head and neck meet. Let's actually do it over here. Probably be better right there. So right where the head and neck meet. Yeah, right. Perfect. Okay. So first off, we have to handle the shin box. Let's move it laterally, very slightly, and inferiorly. Down a little bit, inferiorly. Perfect. Okay. Basically, you just want to make sure you have the acetabulum right here of the pelvis, head, neck, of the femur, and the greater trochanter and the lesser trochanter. And you want to check over here too. You can see the acetabulum a little bit right there. Head, neck, and greater trochanter. So looks good. Let's hide the shin. Perfect. And now, if you didn't see, I want you to pull up your new coronal just because it's the most accurate, and we'll probably have a better image in this. Let's window that down to the right. Perfect. So I want you to angle with just the femoral shaft or body. So let's scroll down maybe one. Oh, I'm sorry. Oh yeah, we don't have a good slice yet. It's because we only have a couple slices so far. So we're gonna angle with that basically. So a little less than that. Yeah, something along those lines. Okay, and scroll down one more and let's see. Yeah. Okay, that looks good. Alright, so what we want now is to oblique it. By the way, the reason why our FOV isn't here is because this is midline. You can see the spine and the spinal canal. So the slice is right through here, but all of our slices are lateral to that, so we don't have the FOV. So yeah, perfect. We obliqued that. Now what we're gonna do is we're gonna scroll up and down and make sure we only have 2 slices past the lateralmost aspect of the hip or the femur. So yeah, go back down like 3. That's our widest. So let's cut until we only have 2 extra. Perfect. Perfect. Okay, so now we're gonna scroll back and check the acetabulum medially and the head of the femur. That looks good. Our coverage looks good there, because I like to cover a little bit more of the acetabulum. You can see the pubic bone right there. You can see either the ischium or the ilium here. I can't tell. So this looks good. 1 times 22 is a perfect 22. So that's a reasonable amount of time. Let's go on to the next one. Now we're going to bring up our new coronal and our new axial. We're going to find those money slices. Yeah, that's the one. So you can see the lesser trochanter right here.
Right.
That's what the iliopsoas muscle inserts on. So you have the psoas muscle up here, and then on the inside, on the internal aspect of the iliac crests, you have the iliacus muscles. They merge and they insert down here on the lesser trochanter. Alright. So now we could drop our FOV right there, right on the transition between the head and the neck. Perfect. Alright, shim box looks like it covers what we need. Over here too, we can hide that. Okay. Now what I want you to do is I want you to make these slices horizontal. We're going to just check our FOV real quick. Perfect. Okay. We can probably rotate that and make it a little bit flatter. That's not how I do mine. Just make it perfect. Okay. Now we don't have our sagittal yet. That's okay. We can oblique it over here. I want you to angle with the femoral neck. Perfect. And now I want you to scroll up and down. We only need 2 slices inferior to the lesser trochanter and 2 slices superior to the greater trochanter, which is not pictured. So lesser trochanter looks good. Go back 1. There's the greater trochanter. So I only need 2 above that. Perfect. Okay. So let's keep scrolling down. Lesser trochanter looks good, but yeah. Okay, cool. Alright. Now we have 23 slices worth of TR. We only need 19. We can, it's a PD, so we could just increase this to, or I'm sorry, decrease it to 1 times 19.
The lowest one?
Yeah. Perfect. Okay. That's very reasonable. And now let's go into the last one. I'm gonna bring up our new money slices over here and over here. So remember, this is series 1, meaning it's the localizer.
So we need to select series.
Yes, exactly.
And it's a coronal.
Perfect. Okay, so let's find those money slices. This looks like a money slice. We're gonna go down. So we're up here in the lumbar spine. Perfect. Okay. So now we could drop our FOV right where the head and the neck meet. Perfect. I like to angle it so this bottom line is kind of perpendicular to the body of the femur. A little less than that though. There you go. That's how I like to angle them personally. Not everyone does them the same. And before we oblique it, I want you to bring up your new sagittal that just came up. So let's highlight this point. Perfect. Okay. And we're gonna scroll up and down, and we're gonna angle with the neck of the femurs. So this is the body and shaft, like down here. This up here
Is the
was
neck.
is the neck, yeah, so. Okay, so yeah, like right in there. Do you feel the need to angle it? It looks pretty good. Alright. Okay, so now that we've handled these two, we can oblique it over here. Perfect. And we're gonna do coverage. We only need 2 slices anterior to the head or anterior lateral. We only need 2 slices posterior medial to the lesser trochanter. Or I'm sorry, greater trochanter. Perfect. Alright, so let's scroll through and make sure as the head. Yeah, there you go, see. So we're gonna have to add one more. Perfect. Okay. Looks good. So 1 times 14 is a perfect 14. Let's save that. Good job. So, a little bit of anatomy. Yeah, let's scroll up to our corona maybe. So, you can see those iliac crests with the iliacus muscle on the inside. Psoas muscle, they converge and insert on the lesser trochanter. You have head, neck, body or shaft, lesser trochanter, and the greater trochanter would be up there. Let's keep scrolling. Here we can see the bladder was right there. So, okay, so let's go back. Not as fast. So, keep going. So you can see the sacrum a little bit right there. Keep going. SI joints right there where the sacrum meets the ilium, and you can see the ilium branching off, and those are the iliac crest is the superior aspect of it. So let's keep going. Let's turn this off, auto view. Oh, right. Yeah, it doesn't do that. I'm trying to think. So here's the acetabulum, basically the socket of the ball and socket joint. That is the hip. Let's go down one image. It is formed by the superior ilium that we were looking at, and that forms like the superior aspect of it. Now the anterior inferior aspect is formed by the ischium down here. You can't really see it in this image, but it's also the anterior superior is formed by the pubic bone, which would course this way to the pubic symphysis. So let's scroll through slow. So down here would be the ischium right there, considering this is like the back of it. Keep going. Actually, that was the anterior aspect because these are the pubic bones right there, and go back up one. Pubic symphysis right there. So pubic bones, keep going, slow. Pubic bone all in there. So yeah, that's the anterior, inferior, and then the ischium would be down there. There's the ischium. Go back one. Right in there. Right in there. That posterior, inferior of the acetabulum. So yeah, it's made of the ischium, ilium, ischium, and pubis. Yeah, that's it for now. I can show you guys more. Greater trochanter, neck, head, acetabulum right there. There is in the coronal plane the zona orbicularis, which we'll get into later on. So let's go back to the coronal actually. It's this muscle or ligament that like surrounds the neck of the femur. Keep going slowly. Let's go to the neck of the femur. Very slowly. I hope we got it. Right there. Go back. Right there. See that band?
Yeah.
Now, between the superior or the greater trochanter and the lesser trochanter down here would be the intertrochanteric line coursing down. This is the zona orbicularis, that ligament that surrounds the neck of the femur. And you also have a labrum in there, but it's hard to see. Really hard to see. Alright, that's it. Great job.